Welcome to The Explainer. Today, we're diving into one of the biggest challenges New Zealand is going to face. What happens to our social safety net when AI changes everything? Now, we're not here to give you easy answers. Instead, we're going to map out the really tough choices and trade-offs that are coming our way, the ones we all need to start thinking about.
All right, so let's get right into it. Think about our welfare system as it is today. Job seeker support, things like that. It's all built around one core idea. You lose your job, the benefit is there as a bridge to help you get to the next one. It was designed for a world where job losses were temporary, kind of predictable.
But AI is a completely different beast. It's less like a temporary storm and more like permanent climate change for the job market. We're not talking about cyclical job losses anymore. We could be looking at structural displacement. Think about it. A job in radiology or in a call center, it might not just disappear for a season. It might be gone for good. And that right there, that's the fundamental problem we have to get our heads around. So if the problem itself is changing so dramatically, then our solutions have to change too. Let's take a look at the different paths we could go down for income support. And it's so important to see these not as just minor policy tweaks, but as fundamental choices based on really different sets of values. Really, it boils down to four main ideas. We could just try to strengthen the system we already have. We could target help specifically at the workers who are getting displaced. We could go for something really radical, like a universal basic income, or we could try a negative income tax. Each one of these paints a totally different picture of what we think we owe each other as a country. And what's so fascinating is that these aren't just theories cooked up in a university. Countries are already out there living these ideas. On one side, you've got Denmark's flex security model. It's all about collective risk. The government steps in with generous support and retraining. Then on the other side, you have Singapore's skills future, which is all about individual responsibility. The government gives you credits, and it's up to you to retrain yourself. Two totally different philosophies trying to solve the exact same problem. Okay, now let's talk about the elephant in the room, universal basic income, or UBI. It is, without a doubt, the most talked about and also the most challenging idea on the table. And what's wild is who supports it. You have people on the left who see a new social floor, and you have libertarians on the right who just see a simpler, more efficient way to do welfare. But, and this is a huge but, there is one massive hurdle: the price tag. To give every adult in New Zealand a meaningful UBI, you'd be looking at a cost of roughly $50 billion every single year. I mean, just let that number sink in for a second. And this chart really puts that number into perspective. $50 billion is more than half of our entire government budget right now. It absolutely dwarfs what we spend on healthcare or on education. Now, that doesn't make it impossible, but it just shows you the sheer scale of the choice we'd be making as a country. So the bottom line is pretty simple. Any serious conversation about UBI has to start with a serious plan for how to pay for it. The options are all on the table. Things like a tax on AI itself, a capital gains tax, a wealth tax. But let's be honest, none of those are politically easy. A realistic plan would almost certainly have to be a mix of a few of them. Okay, let's switch gears and talk about healthcare. Because when it comes to AI, it's a real double-edged sword. It's not some simple story where new technology just rides in and makes everything better. Oh no, it is way more complicated than that. So on the one hand, AI offers this incredible promise. It could be a lifeline, right? A workforce extender that helps with our chronic shortage of specialists, especially out in rural New Zealand. But, and it's a huge but, at the very same time, the economic chaos from mass job losses could create a whole new public health crisis. All the stress, the mental illness, that creates a tidal wave of need that's going to crash right into a system that's already stretched to its absolute limit. But before we can even begin to use these powerful new tools, there's a fundamental roadblock we have to get past. And this isn't an optional extra. It's a non-negotiable, can't-be-broken rule. And here it is. An AI is only as good as the data it's trained on. Most global AI systems are trained on data from non-Māori populations. And the evidence is crystal clear. That means they just don't work as well for Māori patients. An AI that's perfectly accurate in the US might misdiagnose a skin condition or get a reading wrong here, making our existing health inequities even worse. A tool isn't neutral if it's biased. And that means things like Māori data sovereignty and Māori governance are absolutely essential. They are not nice-to-haves, they are hard requirements for a fair system. We have to answer the question of who controls Māori data. We have to demand that these AI tools prove they work for everyone, and we have to ensure Māori have a real seat at the table in the approval process. Period.
This brings us to another huge challenge where AI could just make existing divides even deeper. Housing. Because AI could take our one housing crisis and split it into two completely different crises happening at the same time. It's something called the regional divergence problem. So picture this. In the big cities like Auckland and Wellington, all the new AI jobs cluster together and house prices, which are already through the roof, just go into orbit. Meanwhile, out in the provincial towns where industries get automated away, the local economy gets gutted and property markets could completely collapse.
So what's the takeaway? Well, it's that a single one-size-fits-all national housing policy probably isn't going to work. You might need different tools for different places. Maybe rent stabilization is a circuit breaker for an overheating city, while housing vouchers could help people in a struggling region move to where the new jobs are popping up. But the final piece of this puzzle deals with something deeper, something that income support and housing policies can't fix on their own. And that's the human cost of all this change. We have decades of research on this, and it all points to the same thing. The psychological damage of losing a job goes so much deeper than just the financial stress. For many people, it's an attack on their very sense of self. And this quote just gets right to the heart of it. For so many of us, our job is not just a paycheck. It gives us a routine, it connects us to other people, it gives us an identity and a sense of purpose. And when you lose that, that's a profound blow that no weekly payment can ever truly fix. And get this, the research shows you don't even have to actually lose your job to feel the harm. Just the threat of it can impact your well-being. There's even a name for it, automation anxiety. It's that constant nagging stress of knowing that the skills you've spent your whole life building might suddenly not be needed anymore. And that leaves us with the biggest question of all. If we know for a fact that a job is so much more than just income, then what is a safety net actually for? Is its job just to replace a paycheck? Or does it have a much deeper purpose, to help people find a new sense of meaning and belonging in a changing world? That's not just a policy question. That's a question about what kind of society we truly want to be.